And we're off to the Health Hub Times Square in Ballincollig, where Anneliese Dressel is joining me this afternoon. Good afternoon, Anneliese.
Good afternoon, Patricia.
You survived all the heavy rain on Saturday.
Yeah, it was actually, I managed to get out for a walk in the middle of it thinking, oh great, and I got completely and utterly drenched. I don't think I've had a drenching like that all summer. So we had actually, if you think about it, we didn't have that bad a summer because I don't remember too many days like that.
Yeah, it was incredible. It was incredible. We had to drive. We were in Kilkenny on Friday night and driving back into it because it didn't early on hit sort of that kind of area around Kilkenny heading into Tipperary. But my God, when we got into Cork, it was just torrential, and the amount of water on the ground as well.
Absolutely, and actually, I just hope, Patricia, that people like that the council are clearing the leaves, because that is one of the biggest problems, is that the leaves block up the drain and the water has nowhere to go.
Yeah.
So I hope that that's happening this year, especially for Middleton as well. They were hit so badly last year. Yeah,
and it was Bantry got out of them this time.
This year, yeah.
Okay, let's get straight into your questions, and listeners can keep them coming. You can call John Paul 0818 103 103, but there's a few early ones in by text, including this one came in bright and early. Could you please ask Anneliese, can you take L-theanine and lemon balm while also taking anxiety medication?
Yes, absolutely you can. Now, I just wouldn't take it at the same time. I always think pharmaceutical drugs and natural things should be taken at least a half an hour apart, because sometimes the natural stuff can improve the way your liver detoxifies the pharmaceutical drugs. So you mightn't be getting the right dose. So give yourself at least a half an hour, but they actually work very, very well to prop up anti-anxiety medication. So it just has a very nice ability to bring down the kind of stress hormones that make you feel jittery and anxious. And they also help with the busy brain. So a lot of people would just take it not even for anxiety, but just for the busy brain at night going to sleep. Perfectly safe with anti-anxiety medication.
Okay, and somebody who is 70 says, could you please ask Anneliese, what dose of vitamin D should I be taking? Is there a set dose?
No, there isn't really. Now, 1,000 IUs, I think, is generally safe enough for everybody to take. Some people actually, Patricia, don't process vitamin D very well, and they will need more. And some people, sorry for reading Patricia there.
Okay.
So some people might need a higher dose. So the only way really to know for sure is to actually get a vitamin D test done. So what I would suggest to most people is take 1,000 IUs, take it throughout the winter months for at least a couple of months, and then go and get your bloods checked with your doctor. And if it's, in the optimal level, then 1,000 is enough. If it's too high, it's too much. And if it's too low, you need more. So that's the best way really of judging it. And we do have a cheap and cheerful vitamin D test here in the shop. I think it's about 13 quid. It tells you whether you have adequate vitamin D. It doesn't give you any numbers. But at least if you're taking vitamin D, it is a way of judging if you've got enough.
Okay. Now, somebody says, this is from Eileen. Hi, could you ask Anneliese, please? Is there anything you can do for low blood pressure? I eat potatoes to get rid of that lightheadedness, and I'm drinking lots of water. I'm looking for advice, please.
Yeah, absolutely. A couple of things would help there. The first thing I would suggest, if you're drinking plenty of water, is put a pinch of salt actually into the water rather than depend on potatoes. Because potatoes probably aren't flavoured with the sea salt. They're probably like it's more sodium chloride, which is not the healthiest version of salt. So at least if you've got sea salt, you're getting all of the other minerals like magnesium, calcium, potassium in the right balance to keep your electrolytes right in your bloodstream. So just add a pinch of salt into your water, and if you don't like the taste of salt in your water, you can actually buy electrolytes very, very simply in the health shop. And you can add them in instead of having to eat your crisps. And then the other thing that's very good to increase blood pressure is licorice. And I would routinely drink licorice tea if I feel my blood pressure is getting a bit low. You always know, because when you bend down, you get those kind of glittery spots and feel a bit dizzy. So licorice is very good to elevate blood pressure. You can eat it or you can drink licorice tea. So then, on the other hand, if you've got uncontrolled high blood pressure or if you're on blood pressure medication, You could obviously have the odd cup of licorice tea and the odd bit of licorice, but wouldn't be doing it regularly. It's very, very effective to bring up low blood pressure.
Okay, Mary says, I got COVID twice last year in 2023 and then I got it again in August of this year. I'm the only one in the household who keeps getting it. Why am I getting it so often? Is there anything I can do? Is it to do with my immune system? Is there anything I can do to boost my immune system? Any way to improve it? Any advice from Anneliese, please?
So it's a difficult one to know. Patricia, sorry, for some reason here my door, Patricia, isn't working and people are walking in and they've been able to get in. I don't understand why.
Okay, you are
anyway,
right. Okay.
Yeah, I'll just make sure that's closed there.
Okay.
Pardon me for
You're
that.
okay. You're okay.
It's a strange one, Patricia. Some people never get the flu either, and it's hard to know why. I think somehow their first line of defence, which is your T cells and your white blood cells, they must be very efficient at kind of getting to work very quickly and getting to the virus before it has time to replicate. But this is only a theory on my part. I think as well, lots and lots of studies on vitamin D levels have shown that people whose vitamin D levels are lower are more likely to get COVID and more likely to end up in the hospital with COVID. So again, if you need more vitamin D than the average person, and if you're not taking vitamin D, that could impact it. I think stress is a big factor. In fact, I think even in terms of long COVID, a lot of the people I see that have long COVID had very stressful lives prior to that. So there's a whole load of reasons why you might be more prone to getting it than other people. So what I would suggest is I would take a good quality immune booster. And I love the one Nature's Plus Immune Boost one because it's got your vitamin D, C, zinc, selenium, a little bit of vitamin A in there. And there's also something in there called NAC, N-acetylcysteine, which is particularly good as a kind of a natural anti-inflammatory, great for anything lung-wise. And we gave it to people a lot after COVID who couldn't shift the cough, and they found it great. So that would be a good kind of one to keep as a preventative. And then I would keep echinacea in your medicine cupboard, and as soon as you'd feel a sniffle, start on the echinacea quick, because that's the one that increases your white blood cells, the first line of defence, very, very quickly. And that's what you want in order to prevent the virus taking hold and being able to replicate.
Okay, talking of viruses, there seems to be a lot of sore throats doing the rounds. David was on to us earlier. Any advice for a sore throat to try to clear it up quickly? Any quick way to get rid of a sore throat?
Well, again, you see, I suppose sore throats, if it's a bacterial thing, Patricia, and some people are viral things, some people are prone to getting them. So it's really about preventing your supporting your immune system so it's less likely to happen. So again, the one I often talk about is that elderberry complex. It's a great all-arounder. Or that Nature's Plus Immune Boost I particularly like for viral. So if it's more bacterial, I'd go with the BioNutri elderberry complex as a preventative. And if it's a viral, go with the Nature's Plus Immune Boost. But then as soon as you feel a tickle, you could either start taking the Dr. Dealish Clare has a throat spray, and there is echinacea in it, and you can spray it right onto the throat and tonsils. It's very, very, very good. And gargling even just with plain salt and water can help as well. Some people find for the bacterial throat infections that colloidal silver as a spray is a game changer. So I would try a few of those things and find the right system. But waiting until you get a sore throat, your immune system is already under pressure then to fight it. So make sure it has everything to fight the good fight before it even starts by taking something routinely throughout the winter.
Okay, hi Anneliese, this is Anne-Marie on behalf of her mother. My mother is suffering from dry, flaky skin condition, but it's just around her eyes. Anne-Marie said, looking at it, it looks like eczema or eczema. It's itchy, but not sore. Is there anything you could recommend for dry, flaky skin just around the eyes?
And is it in the eyelids, Patricia? Or is it just, anyway, I think it could be a couple of things. Like, I do know that sometimes if people are using a shampoo that disagrees with their head, maybe there's, that could, if there's dermatitis or dandruff in the scalp, that can often make the eyes or the ears itchy, but not the rest of the face. They seem to be particularly sensitive areas. I do think as well, if people are allergic to various different things, you'll often see it in their eyes, and it's because the skin around the eyes is so fine and sensitive that it's very easily damaged or inflamed or irritated. So, I suppose rule out if there are any other allergies at all. I would switch to a shampoo that has got no sodium lauryl sulfate in there. And one that's very good if the scalp is dry and itchy is the Hopes Relief. It's brilliant if you've got psoriasis or if you've got dry and itchy, flaky scalp. And then if you believe it's kind of a fungal thing, so adding some grapefruit seed extract into a natural shampoo is great for kind of fungal-related dandruff. So that's if it's not allergy-related. And I think that's probably the most likely cause. I do see it often in the shop that people are reacting to a shampoo or something and it is actually itching their eyes and their ears. So that might be the reason.
Okay, Norma, is there anything that to help with diverticulitis? My husband has just been diagnosed with it, so it's all new to us at the moment, says Norma.
Okay, so diverticulitis. There's diverticulosis and diverticulitis. So diverticulosis is where the smooth muscle of the colon has become weak in particular areas and it kind of blows out into a pouch. So the problem then is that food particles or undigested food or fecal matter can get stuck in those pouches and can become infected, and that's then when it's called diverticulitis. Itis is always inflamed. And most people at that point probably need an antibiotic. So really it's all about prevention and making sure that you have a good, healthy daily bowel movement. So anything that can help that happen. Some people find aloe vera juice is very soothing and cooling. It's got great healing properties, so you can take it as a juice. Or we also get great feedback on a natural laxative, which is aloe pura colon complex, or aloe complex, I think it's called now. That's very good if you are struggling to have a daily bowel movement without straining as well. Patricia, straining puts more pressure on that smooth muscle. Another thing I love too is the psyllium husk. It's a soluble fibre. You could just add a spoon of it onto your breakfast cereal in the morning or maybe into a yogurt, but make sure you drink a pint of water with it to hydrate it. Another good tip is to soak a tablespoon of linseeds overnight, and then the next morning you'll see, in a small glass of water, you'll see that the glass of the water has turned kind of gel-like. So that's a soluble fibre, and it's great to kind of soften a stool and help it pass through very, very gently. So you can just drink that water, or you could put it into your breakfast cereal. It's totally tasteless. So any of those are great. Eating a couple of kiwis a day is another great way to get the soluble fibre into you. But really it's all about making sure that you're not straining, that you're having a good daily bowel movement. Probiotics as well, if you've taken an antibiotic afterwards, to put the good bacteria in there to prevent any further inflammation.
Okay, well, let's get back to those customers who are bursting the door down to get in. Listen, thanks a million. We'll talk to you next Monday. Cheers for that. That is Anneliese Dressel of the Health Hub Times Square in Ballincollig.